this again. Um, okay. Today is July 27th. I was trying to look up a video and just see on YouTube if there was anything about what I'm about to talk about, but I didn't even know what to look up. But what I experienced this past year, I was working at Perelman School of Medicine, University of Pennsylvania, for, I don't know, whole health study, probably DOD and secret Google study, maybe, I'm not sure. If I was a patient, I definitely didn't sign an informed consent, but I know that they were training an AI off of me and my notes, and I'm pretty sure they used my data and said an AI did it. And there were definitely certain times when they were able to influence certain decisions that I made, but that was using MK Ultra stuff, for real. So I had a surgery. It was following seeing infectious disease and wanting to change an antibiotic for my left knee, because my leg, as you can see, beautiful job compared. I was on doxycycline for years since my first surgery in 2015, and I was getting married, and I was thinking, oh, maybe I'll have a baby, but I want to be on like an antibiotic that is not bad if you conceive. So they switched me to amoxicillin, but they didn't recommend that I taper off the one while I start the other one. So there was this lapse where it takes a good amount of time for amoxicillin to start working. And you would think that they would have had me taper, but anyway, I got an infection that required an emergency revision, a removal of my prosthesis, replacement spacers where I didn't have a knee for months, and then replacing it. And the surgeon said that he told me that he said that he had to hit me with a hammer for like hours, but the rod was already cemented into my bone and it shouldn't have been. But when I looked at the clinical notes, it didn't indicate that at all. It indicated that he ordered the cement, and the pain that I was in, I woke up screaming, right? So like, I don't know, was that all to make a fucking Sarah McLachlan and like Tori Amos song come true? Because if so, that's really fucking horrible. Yeah, so I've found myself since then living out all these fucking songs, movies, books, things that I liked, things that I read. Like, for instance, some things that I used to like, I fucking hate now. Like, Shane Carruth, Primer. Fucking nightmare. Oh, and Upstream Color. Another nightmare. Still in a nightmare. Got married, got a divorce. Still here, no car, no job, no income, no money. Fucking. But I do have a theory about people with type 2 personality disorders, excluding BPD, and excluding antisocial, but the rest. And I think that I'm hesitant to say communist, but some maybe like phased out project where they were trying to create some type of super soldier, who didn't feel guilt, didn't feel a connection, didn't feel bad about things they may have to do, but also could perhaps be a vessel for a computer program. And very similar to Westworld. But what that would involve is something kind of like the Kurzweil, to create a mind when they freeze half your brain. Like, I'm pretty sure they froze half my brain, the creative side, and then just, repurposed it for storing memories. Because when I got woken up, or I don't know, maybe I woke myself up, made choices that woke me up. I'm not sure. Basically, it was like I remembered all of these events, kind of like in a certain order, like something unraveling. And then I was like commenting on them at the same time, but there was, at that time, definitely they're able to influence my thinking. And plus they had me down so low. It was like I went from like 0 to 99 by like doing weird math things. I don't know. But LinkedIn, don't use it. That should be illegal. I don't have a LinkedIn, so I don't know why there's a link for one on my website. They keep fucking with it. But I have a theory that maybe they were doing something to dismantle like the frontal lobe, freeze it, repurpose it. But maybe so maybe these people, either they don't have a functioning frontal lobe, or I'm not sure. But I think that perhaps there's a way to repurpose partition off another part of their brain for that, utilizing empathogens combined with neurotropics for like just aiding memory, and then like just creating new neural pathways by group therapy repetition. So yeah, empathogens meaning MDMA, maybe a combination of that with I would say like Ketasite, Ketochloride, and maybe like a little psilocybin or something like that. But yeah, not LSD though.